Hi everybody, welcome to today's webinar. There may be a few more joining as we go, but before I start, I'll just introduce myself. So my name's Russell Cartwright. Nice to see some familiar faces on the call. I've worked in NHS communications for the last 25 years or so. So in that time, in the last sort of 6 or 7 years, I've become a specialist in behaviour change campaigns, and I now support other public sector communications teams to run use behaviour change, use behavioural science to run impactful campaigns in-house by providing some training and some consultancy. And some of you have been to some of these public health comms hubs before, but for anyone who hasn't, I set up this with the support from Can Digital around 2.5 years ago, as a space really to share good practice. We run a series of free webinars now, and this is obviously one of them. And we over time we've now got, I think, over 700 people signed up to the hub, which is brilliant. We'll be recording today's session, and we'll publish the recording of that and share it with you and everyone who's a member of the hub, and we'll share the slides that are used. Please do put any questions for us in chat. We'll keep an eye on that, and if there's time at the end, we'll take as many of those as we can. And also, if you've got any suggestions for any topics that you'd like us to cover in a future Public Health Comms Hub webinar, also put that in chat, and yeah, we'll see if we can do something around that for you. So today we're going to be discussing a topic that is very close to my heart. And that is mental health, and also three closely linked addictions, so gambling, alcohol, and drugs. And when it comes to mental health, sadly, there's quite a bit of evidence which shows that stigma and discrimination is increasing. We made so much progress in this area. For those of you who might remember the Time to Change campaign, well, that over a period of time, and by continual it made continual progress really when it came to this area. So it helped. We saw big improvements in public attitudes towards mental health and mental ill health, alongside decreases in discrimination. But unfortunately, Mind's big mental health report that came out last year really did show that things are slipping back in all of these areas. And it has done kind of slowly since Time to Change ended, which was around 2000, I believe. So yeah, understanding of mental health is declining. Attitudes towards it are becoming less accepting. Willingness to engage with someone who has mental ill health is decreasing. Workplace stigma continues to be a challenge, and things like understanding of conditions like schizophrenia is still very much misunderstood, sadly. Stigma is also a big issue for the addictions that we're going to look at today as well. So while the stigma has increased, alongside that, we're also seeing a big increase in demand for services. So common mental health problems are increasing, and there are more of them. There's a growing kind of cynicism around mental health, which probably is linked to that stigma. But we've all probably heard people, young people weren't like that. Young people didn't have diagnoses of mental health in my day, and that sort of thing. So yeah, that cynicism seems to be rising. Things like loneliness, which contribute, is rising. Suicide and self-harm, they remain high. We saw with the COVID pandemic the kind of there was a mental health legacy of that, and all of the restrictions and everything. And unfortunately, that in many areas that those widen some of the pre-existing inequalities. Schools have been seeing increased problems and increased, mental health concerns, and also all the stuff that's going on in the world at the moment. The cost of living crises, wars. People are dealing with social and environmental uncertainty. Social media, while it does some good, it also creates divides. And I think a key thing, mental health being 20% of the burden of disease, but only getting 10% of NHS funding. So there is an issue there. We're also starting to see the impact of austerity measures, further down the line now, and where services and social services and things like that have been cut, and sort of we're really seeing how that has the knock-on effects, really. And I think all of these aspects, they also contribute to mental ill health, but also to I think the prevalence of the other unhealthy addictions that we're talking about today. So just talking a little bit about gambling specifically. So we know that Gamble Aware is closing as of April 2026, and they kind of have a role around prevention and currently, and that's going. There's a welcome level of investment going to upper tier local authorities. So over 2 years, OHID are allocating 24 million to fund prevention activities. But it's a difficult landscape, and Matt's going to expand on this a lot more. But gambling companies spend an estimated 2 billion marketing their services in the UK a year. So that's what that 20, that if you put that 24 million up against that, it pales in insignificance. As they spend that money, gambling is framed as fun and risk free. And there are studies which show that the public perception of people who experience gambling harms is that they are seen as a bit abnormal, or that they're irresponsible. It's framed as a personal issue to them. And there's a really interesting recent UK study which looked at regular gamblers and their urge to gamble. And basically they were showing different adverts, and we've all seen the gambling company adverts, where it's trying to promote safe gambling or whatever. And actually, when people were shown those adverts, their urge to gamble increased, probably by the recognition of the gambling company's branding, or just the fact that they were the way it was framed basically increased the urge to gamble. People were shown a Gamble Aware Bet Regret advert, and their urge to gamble stayed broadly the same. The only thing that actually decreased their urge to gamble was, again, it was a Gamble Aware advert, but one that focused on stigma reduction and increasing understanding around the harms of gambling. Just thought that was quite interesting to share. But I'm going to bring in Matt from CAN, who is going to talk about each of these areas. And I think Matt's going to talk about some of the tactics that some of the gambling companies and some of the other companies involved in the other addictions might use, and show the challenges that we're against. I think with each of these areas, there's a real risk that if we don't, I'm trying to split this up. There's a real risk that if we don't get our messaging right, and if we use the wrong channels, we could actually, as communicators, make these problems worse. And Matt's going to help illustrate that. So, Matt, can I bring you in and can I ask you to introduce yourself, please?
Yeah, of course. Thank you, Russell. Lovely. So as Russell said, I'm Matt from CAN Digital. We're a public sector only digital advertising agency, and our main mission is to help public sector basically reach the right audience in the right place at the right time to drive down cost per outcomes as low as possible. I'm just going to cover off sort of mental health and then focus on the two topics Russell was speaking on, so gambling and drug and alcohol abuse. So looking at sort of the base level, so digital usage. So the average person interacts with thousands of websites and channels every single month. in January this year alone, 97.8% of the UK population were internet users. So we're getting close to that 100% month on month. And the average time spent online is 4 hours, 30 minutes per day, which is an insane amount of nearly 200 hours per month. So obviously this can lead to loads of amounts of misinformation, disinformation consumed online. But are these people actually getting the help that they need? So when people need help these days, they search. So searching is the most common way that people seek health and well-being information. These searches often happen privately, they happen late at night, they happen when people are sitting at home alone. What people see next can really shape the decisions and the outcomes for that individual. And this is often before residents have even had any contact with services or even opened up to a loved one about their issues. And so how do people actually seek help online? It's our lovely friend, Dr. Google. So Google basically responds to just over 16.5 billion searches per day. 500 million of them are done in the UK, and 50 million of those are health related. So this is actually the single biggest health front door for public health, and they don't actively manage it. So how can we change that? So what we start to see from search is it's basically a window into your residents' minds. What your residents are searching for basically reveals unmet need. The search data often appears before contact with services, and this insight can inform prevention, messaging, and service design. And it's the earliest possible intervention point. So I had a little look at I basically picked one local authority in England and had a little report into what people are searching for and how many times they're being searched in this one local authority area. So with anxiety, this is year round, 12 months of the year, every single month, with not huge big spikes based on whatever. It might be mental health week or it might be depression that's going on in campaigns. It's just people are searching every single month. And in this one location, there's, I think, over 4,000 searches per month relating to anxiety. When we look at depression, again, sort of 2,000 searches per month around people searching for depression. And these are just a handful of search terms that I've plugged in. Obviously, there's loads of variations that your residents will be searching in all these different terms. So the actual true number could be 5, 10, 20 times these number of searches being done. If you look into sort of suicide prevention in this local authority, painless ways to die is being searched 140 times a month, which is just insane. And then grief again, 4,500 searches per month. And you've just got to remember is these searches are going somewhere. And if they're not going to the help that the local authority and the public health service provide, they're going somewhere, and it could be getting worse. It could be causing more harm. And another one in there for sleep. So what this actually means for public health is it shows the unmet need in real time, often outside of office hours. If you're able to deliver early intervention at this point, it can reduce escalation into crisis and statutory services, so homelessness and things like that. These searches don't exist in a vacuum. Without trusted signposting, every one of those searches is going to be answered by something, probably some sort of a commercial advert, a social or algorithmic content, and this will generally just make the problem worse and could cost the services even more money further down the line. So some of those searches that deliver sort of bad results that I've been finding are someone searching for financial stress are targeted with payday loans. Someone searching for depression gets targeted with a headset that can cure depression. Someone searching for severe mental health get targeted with an app that you pay £29 a month and it can cure your mental health within a 10-week period. People searching for help with online gambling actually get targeted with online casinos. People searching for vaccine side effects get online forums for misinformation. And so this is really where public health teams can make a meaningful difference. So I got a couple of screenshots of some of these sort of search results that I found. So again, searching for depression, this is one that drives me up the wall. This Flow headset, being targeted with a headset that states within a 5-week period, you can reduce your depression by up to 75%, and you get to pay £399 for the pleasure of having that. So again, a lot of people that are going through depression might be on low income. They see this, they can't afford the headset. They go online, they get a payday loan to pay for the headset, and everything sort of spirals out of control from there. When you start searching for mental well-being support, again, targeted with multiple headsets and an app where by week 5, it can improve your mental well-being, but again, you're paying 29, 39, 49 pound per month for this, and it can drive people into financial difficulties and making their situation worse. And then I didn't know the full extent of what was going on in gambling, but searching some of these, like I've spent my wages in an online casino. You're targeted by online casinos, again, offering you fast withdrawals, offering you bonuses, offering you different deposit schemes on there, again, getting you into more and more trouble and difficulty financially. And a few other examples that I found, again, like stop smoking, claim a free sample of it, equally as addictive nicotine substance, and struggling with finances, and you're just targeted constantly with payday loans. So basically, the private sector are monetizing mental health. So if you look at the mental health industry in the UK is estimated around £3 billion, with the app sector worth over £500 million itself. So you got to just ask yourself, are people getting real help, or are they just paying to get more stressed and get into more trouble? So why use paid search? So I don't know if you're all aware, but paid search are basically the sponsored ads that appear on Google when you search something into the search column there. It captures intent at the moment residents are actively seeking help, and it allows you as public health people to get messages visible where misinformation and commercial ads are competing as well. And it means that you can reach these people before issues escalate into statutory intervention. So again, sort of safeguarding homelessness and crisis response, which can cause massive financial implications into the local authority. And it works 24/7 when a lot of services are closed. It's nights, it's weekends, it's when people are there and they're actually looking for help. You can be there to show them the support that's available, and it's fully measurable. Cost per referral over time with continuous optimization, which is always really important. So what's sort of public health role in this? So it's not replacing clinical services. It's not diagnosing or treating. It's making sure that your residents find safe, evidence-based help at the moments of risk and make it as easy as possible for those residents to get the right support when they need it most. So how can you guys help as a public health team? Number one is turn on search, turn on paid search in your area, and make sure that you're in front of these people when they're searching for help and directing them to the right service so they can get the help that they need. And use the data from search to influence the rest of your campaign. On those screenshots where you see what people are searching for, when you've got a paid search campaign on, or you get that data, what are people searching for relating to mental health? Is it eating disorders? Is it suicide prevention? Is it depression? Is it anxiety? Is it grief? And then use that to influence the creative messaging that you're going to be putting out to those people. So if there's a huge amount of people searching for suicide prevention help, have the creatives answer that question and then put those creatives out to people. So use that to influence the rest of the campaign. And user journey is probably the biggest bugbear of mine when it comes to mental health intervention. I live in Bedford. I don't know if there's anyone from Bedford on the call, but I had a little look at searching myself for I'm struggling with severe mental health. I recorded it on a loom that I can share with everyone after the webinar, but it took me about 13 minutes of bouncing from pillar to post on local authority onto different public health and NHS sites, and I basically lost the plot, gave up, and closed my window down. I tried again with an NHS approach and was given a 48 question referral document, and I'm of sound mental health, and I really struggled to fill it in myself. So if you think of that end user going on there who are really sort of battling in their own head, you need to make it as easy as possible for that person to get the help they need and remove as many hurdles as possible. And that user journey is the most important. It's gathering that minimum amount of data as possible so that the service can pick up the phone, speak to that person, and then start them on their referral process. And always make sure you're tracking these referrals. Measurability, like referrals equals measurability, which equals cost per outcome. And for everything that you do, you want to be making sure that you're measuring the channel used and what that cost per outcome delivers you. And it's always ask yourself these questions when you're running a campaign. It's what percentage of your target audience saw your advert? How many times did they see your advert? How many people took the action we needed? Cost per landing page visit, and then eventually cost per outcome or referral. And then you'll be able to see every channel that you use, what the price cost per outcome is, and then that will influence how you'll be running campaigns in the future. One campaign we've got currently running is in Hammersmith and Fulham. They're investing heavily into digital in all of their public health campaigns. A lot of this is going into paid search that we work with the public health team there. We've got a campaign that's been running about 10 months now for it's more severe mental health, getting close to sort of suicide prevention. But we're basically intercepting these searches that are kind of slipping through the net. Again, a bit like with mental health, the sort of key search words, so anything around suicide and killing yourself is picked up by the Samaritans. Google kind of stops the private sector being able to advertise on there. But the searches that kind of slip through the net are the ones around, like, I feel helpless, I feel lonely, I need help, I need someone to talk to. And they're the ones that can end up in a random Reddit forum discussing all kinds of weird and wonderful things with people from all over the world. What we want to do is intercept those searches and bring them to the help that they need. We saw most of these searches being done between the hours of 11 p.m. and 4 a.m. Obviously, again, people are hiding their mental health struggles from their loved ones. They're doing it either lying in bed, doom scrolling in the middle of the night. So what we did was turn our remarketing on in those times. So for those of you that don't know what remarketing is, it's if you ever look at a pair of shoes online and they follow you around the internet for the rest of your foreseeable life, it's that horrible technology, but used in a good way. So knowing that people are interacting between the hours of 11 p.m. and 4 a.m., being able to be back on their device when they're doom scrolling, showing them the help that's available to them locally becomes really important. And so we then use that strategy in the social media targeting, so on Meta and on Snapchat, getting in front of people, targeting that sort of between 10 p.m. and 5 a.m. and making sure that those people that are doom scrolling and are struggling with mental health, that they get to see the service the local authority has got available to them. Over the 10 months so far, we've appeared in over 15,000 searches and sent just over 3,400 clicks through to the different local services. And from the social media, nighttime and day targeting, just over 10,000 clicks from there. We started off sending traffic to the local authority website, which, as I'm sure a lot of you know, was a big, massive directory with loads and loads and loads of links on there that people are bounced off to all over the place. So what we did was kind of remove the local authority from the journey, and depending on the types of searches people were doing, they were directed to the relevant services. So there was a listening place and these man clubs and a couple of national services there. And again, I'm sure you'll all be aware of this, but trying to get the service data back from these services is quite difficult at times. So we don't have all the referral data to date. But since the campaign went live, the listening place who are supplying some data back, their referrals went from 20 a month to 56. So a massive uptick for them there. But once we do get all the data back from the different services, we can work it back to a cost per referral and share that data with the group. I thought I'd just grab a few screenshots of some of the searches that we've appeared on in Hammersmith and Fulham. So again, I need help now, 10,000 searches being done in one location. I feel hopeless, feeling alone, need someone to talk to. Loads of quite deep searches being done. Help with suicide, feeling empty, can't find happiness. And all of these searches are being done day in, day out in all of your locations. And by turning on paid search, you can intercept these searches and get them through to the relevant services. So next time you're planning a campaign, have a think of the channels that you're going to use and make sure that the channels that you're picking aren't sending more traffic to Google to search for help, which could end up on problematic sites, causing them more problems and then causing the service more money further down the line. And then I'm going to just focus, if that's okay, Russell, I'll go into gambling and then jump into alcohol and drugs after that. So what we know about gambling, I've learned a lot over the last week, doing a lot of research into this as well. It's a lot worse than I actually thought it was. But the Gambling Commission has warned that illegal and harmful gambling ads remain widespread online. Over 70% of all gambling advertising is done now through digital. And this means these, I don't know, horrible organizations with massively deep pockets are using insanely highly targeted, sophisticated algorithms, their behavior-based messaging, and their continued optimizations to reach these people that are vulnerable is basically digital harassment of what they're doing. They monitor behavior so closely. If the behavior changes that they've got based on the account of, if you normally deposit every Saturday to be betting on the football and one Saturday you miss, you get a text message with a bonus alert. If you normally spend X amount per week and you slip down on that, you might get an email, you might get a text message, you might get a bonus drop into your app. The frequency of deposits, If you're regularly depositing 100, 200, £300, they vary the bonuses based on how much that you're actually depositing, just to encourage you to spend more and more and more. And these bonuses just tie people into having to gamble to try and get the money back from the bonuses themselves. It might be deposit £50, get £50, but then you've got to spend 25 times the deposit bonus to actually be able to withdraw funds. So it ties people in to constantly be gambling again. And they're always there, they're everywhere. As soon as anyone's shown an interest in gambling, they're on your emails, they're on your text, they're on search, they're on YouTube, social feeds. And these affiliates, that has become one of the biggest problems of late. They're generally based outside of the UK and they're not regulated as well. So although the sort of the big top players like Paddy Power, Ladbrokes, Coral don't advertise to people that are struggling with gambling, these affiliate websites that will target those people struggling when they're searching for help will visit the top 20 casinos, and they will have Paddy Power, Coral, and Ladbrokes within their list of affiliate sites. So these gambling firms are actually advertising in front of people, but kind of through a back door. An advert that again drives me up the wall, but I'm sure you've all seen it many times. When the fun stops, stop, which basically means that when you stop gambling, your fun stops, and it's obviously backed by all the big gambling organizations. But again, in a way, it just encourages people to gamble. It's generally got sports presenters sitting against it. It'll have the actual brand. It might be Paddy Power, it might be Sky Bet, will always be sitting in the bottom corner of the advert as well. And it kind of reminds me of this. I shouldn't show it because I'm hungry and it's lunchtime. But whenever you see an advert of McDonald's pushing wraps, salads, and smoothies, and you see the golden arches and you hear the da 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 da, all I think about is a double Big Mac and fries. And it's that same kind of approach as what the gambling industry is doing currently. Apologies, it is lunchtime and there's a load of burgers on the screen. So what we're seeing on search when it comes to gambling is Google is doing a good job when it comes to very specific searches. So people searching for, I'm addicted to gambling, gambling help, self-exclusion, GamStop, Gamble Aware. These journeys are usually surfacing with the tools that we'd expect. So NHS clinics, gambling support charities, and GamStops. So these users have sort of self-identified their own risk early, and they are getting through to get the help that they need. The problem is the environment's changed a lot. There's the tools that these people have where you can use GamStop that basically blocks your bank account and your name and your postcode being able to be set up on new gambling websites, and individual banking apps. You can block gambling websites from being able to be deposited. The gambling firms have found a way around there by offering different deposit methods. So a lot of them nowadays are offering, you can deposit through PayPal. So instead of someone directly transferring from their bank account, they can deposit into PayPal, which is allowed by their bank, and then deposit from PayPal into the banking apps to continue this journey. So what we're seeing is these high risk searches they're not actually searching for help. They're searching for ways to keep on gambling. So people that are searching for casinos not on GamStop, pay by PayPal Casino, casinos that accept banking transfers where you can go through third parties that are unregulated. And these journeys explicitly signal that these people have had prior self-exclusion, they've got active financial blocking, and they're always looking for new ways to continue playing. And these users know they have a problem. And this is where you need to be able to give these people the support that they need at their time of need. And intervening, again, using paid search as it captures that real intent. They're blocked, they're in distress, and they're seeking a way back in. And there's so many searches in every location up and down the country being done every single month by these people looking for help to get back into gambling. And again, similar to generic mental health, there's a big spike in searches between 11 p.m. and 4 a.m., especially at weekends, especially around sort of sporting events, Cheltenham, World Cup, the golf that was on recently, and the number of searches sort of spikes around those events. And this can be the last digital checkpoint before real harm kind of escalates. And it's the perfect moment for a trusted local message to sort of interrupt that harm and connect someone to support. And that's where public health need to be. So I did a report, again, this is just one local authority again in England, but you can see these other deposit methods. So that's the PayPal deposit, bank transfer deposits. And again, it's just a handful of search terms. There could be 5, 10, 20 times more than this. But over the last 2 years, it's more than doubled. in one location, and there's sort of 600, 700 searches per month around this, and that's just one location. And so being able to be on paid search and intercept these searches and get the people the help they need can sort of transform their lives and also save local services money further down the line. So who do we try and reach whenever we run sort of gambling harm campaigns? Lower income is obviously a bit of a priority because gambling losses have a more severe consequence when you're in a family household on low income. We're finding that tradespeople and shift workers interact very highly with campaigns. Obviously, working extended working hours and irregular shifts means you get a lot more exposure to gambling advertisements, and generally local support is closed at that time. Armed and ex-armed forces, obviously gambling intersects with sort of trauma and isolation, and they're more susceptible. And men 25 to 55 basically get the highest exposure to gambling advertising. It's the biggest target market for gambling firms, and they're also in the lowest likelihood of self-referral in early stages. So being able to target these different groups will help you deliver this service. And what a campaign should look like. So if we're building gambling awareness campaigns, we basically will start with always paid search. It needs to underpin all sort of campaigns when it comes to mental health. Once you get that activity up and running, review the data. What are people searching for the most? What help are they looking for? And use that data to influence the campaign, have it influence the creative messages that you're going to appear, the areas that you're going to focus on. And then looking at the different audiences on the previous slide, aim to reach sort of 95% of that target audience multiple times using multiple platforms. So obviously Meta's got quite good reach, but you look at Snapchat, it's delivering really good results up and down the country. The Google Display Network being able to target these different groups across news, sport, cultural sites on there as well. And then use assets to reduce stigma. So avoid anything around problem gambling or addict, and use non-judgmental language in the sort of search results and the adverts. And again, I can never say it enough, but a really easy to use referral form. Make it really simple for that person at that moment to get the help that they need. And as always, outcome data is paramount when we come to running campaigns. We're running a current campaign with Break Even, who are a national gambling charity, working alongside with Hertfordshire Public Health Team. So we're targeting people within Hertfordshire on paid search and sending them to the Break Even site. Even though the referral form is clunky, I suppose you could say, and there's a lot of questions on there, we've been able to get the service to duplicate the landing page for referrals so that we can send traffic to a very specific landing page, so we can correlate that back to the referrals from the activity we're running. It's only been running a couple of weeks, and I've had 4 referrals so far from 300 clicks, which is roughly about £150 cost per referral. If we're able to get the number of questions being asked in the referral form reduced, we think we can get that down as low as sort of 25 to £30 cost per referral. So there's always going to be work to be done. And looking at, this was just a screenshot from the back end of Google. It looks a bit untidy on there, so apologies. But looking at, of all the searches being done, GamStop and GamCare are only reaching a small percentage of those searches, but the Break Even charity run this campaign is reaching 66%. And then on the top right, you've got your absolute top of page result, which is that number 1 result, which is really important. GamStop are barely getting 5% as number 1, where Break Even and Hertfordshire Council are now getting 70% as that number 1, which means you're appearing above those other organizations that are trying to get people to go down a slippery slope back into gambling, and some of the little searches that are people are doing in the area that we can bring through. And using the cost per referral, we're now working with Hertfordshire to work on a sort of invest to save for gambling. So using all the inputs, outputs, and outcomes that we're able to achieve, and then we're going to start to build a financial case for every pound spent equals a pound saved, work out what those 2 numbers will be, and then we'll be able to work on invest to save to avoid escalation. Drink and drugs. Right, what we see. It's basically the same as other mental health. It's the same digital behaviors apply across gambling, alcohol, and substance misuse. Again, the number of searches that we see are done late at night when people are in private. They're either lying in bed struggling with their own brain, and they're searching online for help. And again, massively overcomplicated referral forms. And for an audience that are, you're trying to reach an audience that are under the influence, putting them in front of a referral form with 150 questions. I couldn't sit there and do it myself, let alone if you're under the influence of something. If someone is accepted that they've got a problem, gone online, seeking help, and then they get given a massive big form, you want to make it as easy as possible for them just to get the help that they need so much. So making that as easy as possible. And without that, the drop off percentages are sort of 60, 75%. So you're really missing out on an opportunity there. And there's a little search from another local authority around uh, drug and alcohol abuse. Obviously, no one ever searches for drug and alcohol abuse unless they work in a public sector public health team. But you can see benzos and magic mushrooms, insane amounts of searches every month. So again, then using that data to influence the campaign that you're going to run off the back of it. We're running a stigma campaign in Hertfordshire around drug and alcohol abuse. Because we were sending all the traffic to quite a clunky referral page, we've built a dedicated landing page, taken a paid search approach, remarketing to people again based on the time of day that they're searching for, and again overlaying that with some social activity targeting those sorts of time of day, doom scrolling between 11 p.m. and 4 a.m. Some of the searches that we've been intercepting, it's only been running for about a week now. But again, I need help with drugs, help living with alcoholic, teen is drinking too much, I'm horrible when I drink. And this is the landing page. I don't know if this will work, Russell, but if I jump out of there into here, does that work? Right, so this is the landing page that we built. We've got a real life person. We've got an experienced person on there talking through the problems that they had. And what this gives us is multiple outcome points. So we can see how many times people have clicked for tips on alcohol or tips on drug use. There's 2 quizzes, one on each, that someone can go in and fill it in. And again, that'll be more outcome data. And then a really easy to use form that's auto-populatable from a mobile device. So they can go on, select the support that they need, how they want to be contacted, giving them the power, an email address, and a phone number. Accept the privacy policy. That information goes through to the service. They can pick up the phone and start the referral process as quickly as possible. Okay. I can share the link as well in the chat afterwards. Sorry, I'm going on quite a bit, Russell. And so, yeah, when it comes to user experience, not loads and loads of text, real life video content, super simple referral form with about 5 points of data if possible, and then gather additional data if you can. So like the survey on there or the quiz. And then how we'd run a campaign for this side of things, again, heavily focusing on paid search, again, reviewing all that data to see what people are searching for most and using that to influence your creative messaging and areas of focus, using assets that reduce stigma and a really easy to use referral form. And as always, outcome data. And then the invest to save sits again behind that. I could talk about this till the cows come home. So yeah, if anyone wants to have a chat about search data in your area, insight from other parts of the country that's working well on these sorts of campaigns, or just for a general public health chat, I am always here.
There's some questions in chat which I'll come to in a moment. First one is actually from a former colleague of mine, Ilario, who has and a similar question from Mike actually. So it asks how you're able to get granular, extremely geo-targeted data from Google, since they often restrict search data when they're too small for an area and are related to protected characteristics. And then Mike kind of agreed to that and said, I'd love to know what people are searching for in Islington or North London. Google Trends only looks like it can drill down to England.
So London's always the hardest one. You can't see the insight by borough until a campaign is live. So we can see North London and South London. So we use a few multiple platforms that are basically built for brands to compare market sort of share of voice against each other. And I've kind of altered it to look at brands as keywords, and it gives us a bit of an insight that way until the campaign's up and running and you start to see the keywords that you're bidding on and those that you're unable to bid on. You can get a more realistic view of an area like Islington. You can target with Google as low as 1 kilometer radius and then target there, so by ward or by location. protected characteristics are really hard. We have regular catch-ups with Google to try and, because we work with so many different local authorities and public health teams, you can get sort of like an exception order from Google where you're able to advertise against sort of special category data. Mental health is always one. Drink and drugs is another problematic one, especially when the landing page has got names of drugs on there and the creatives have got names of drugs on there. Google basically, because it's a machine, thinks that you're selling drugs, so it kind of blocks you. The only way we get around it is just having regular catch-ups with Google to make sure that the campaigns that we're running can reach the people that we're trying to reach. Some of the times we have to get either the director of service to send an email that we can then forward to Google to show that we're working with a local NHS team to kind of get those campaigns up and running. But yeah, any location outside of London, I can see the search insight for that. Anything within London, you would need to get a campaign up and running to really see the insight. Hopefully that answers your question, Mike.
Thanks, Matt. I know in the past, John Paul, who's not here today, has offered, like, if local authorities or NHS organisations are looking for some data to try and, you know, to share some that Can might have available. So without making any promises that I can't keep it, it's always worth asking, because Can may be able to help with some insight that could be useful for you.
Always happy to help. There's a big list of people that are trying to get data at the minute, so I can't promise it'll be this week, but if you drop us a line, we can sort something out.
This is an interesting one from Sean. Says, does this mean that public sector budgets have to compete with private sector competitors on search listings? I mean, the figure I gave at the start for how much the gambling agencies use on marketing was huge in comparison to what local authorities are getting. But it looks like you've shown that with a smaller budget you can compete. So yeah, do you want to have a go answering that question, Matt?
You always have to compete. I think you pick your battles with some of the keywords, and once the campaign gets started, you can see what sort of keywords that the private sector are willing to pay a lot more for, and then you can kind of play a bit of a balancing act to make sure that your budget's not hoovered up in one day, but you're bringing a sort of steady stream of referrals coming through. But even just to test it and spend, I don't know, a couple of grand in search to work it to a cost per referral. And once you get that number and you can work out how many referrals goes through to a completion and what the potential savings is there. So if you didn't spend £10 for that click and that person didn't get the help that they needed and ended up in dire needs, homeless, kids in social care, what that financial implication would be to the local authority, and then being able to work to that invest to save business case. So you'll always have to compete, but it's using search to, sounds horrible, but the low hanging fruit, get the people that are actually looking for help in and get them the help they need, and then work on an invest to save to bring those other people through as well.
Thanks. Yeah, I mean, I think that the other big thing with this as well is that, you know, an instinct might be all these big companies are spending all this money on, you know, search advertising or big advertising. We need to try and do something different. But as Matt showed on one of his slides earlier, the risk is if you do something different, like for instance, if you put all your budget into out of home advertising or something, what you're going to do then is drive more people to search on Google and get targeted by these unscrupulous companies as well. So you kind of, it's a game that you do need to be in, but play it clever, really, I think is to summarize what Matt said. Good question here from Ilario again, around how is AI changing all of this? Because often we've all seen them, the AI generated summaries that come up before the sponsored results. Ilario says that he knows that Yoast is now creating an LMS.txt markdown to help LLMs understand better the content of your website. Yeah.
So when I spoke to Google, so they've told us that they've lost about 7% of search traffic is now gone into AI. It's people are asking questions rather than searching when it comes down to AI. And they're working on because obviously Google's lost a lot of money, but the search is going into AI now, but they're working on a sort of a paid platform to advertise within the AI results. what AI basically does is scan the internet for a similar question to what you're asking and what that answer is. And the majority of the data it will pull is from Reddit, because Reddit is basically a Q&A system. So to be able to get public sector, public health results and information into AI, you need to build a page of like a Q&A of what everyone will be asking for specifically about that service. So people that are searching for, I need help to stop gambling, have an answer to that in there. Google will see the .gov.uk domain as well. So you'll get the trustworthiness mark, and you'll be more likely than the private sector to have your answer going into the AI result than you would the private individual, the private organizations. But content on your website should be structured in a sort of a Q&A fashion to allow the AI to read it easily and pull the information across.
Yeah, so doing both of those basically is the way to go, isn't it, by the sounds? Okay. Another question from Ilario. Can you expand on remarketing when it comes to health issues? We've been blocked in the past because the servers are outside the EU and health is a protected characteristic.
Yeah, so special category data is a bit problematic when it comes to remarketing. There's some audience platforms that allow you to only have servers based in the UK. Google is one of the biggest. You've got, it's like, what's the other one? AppNexus is one that works well, but it's basically don't use Meta. So you never use a Meta pixel, because obviously they silo their data, they resell their data. So having, even just going down the route of having a Google Pixel as remarketing only, it reduces the volume, but you'll get around the special category data part of things. So for remarketing, I'd only have a Google Display Network Pixel in there.
Okay, thank you. Next one's about stop smoking. So I'll have a go at answering this, and you might want to add to it now. Which is my phone has just gone off. There we go. Have we done anything similar to support stop smoking campaigns? So we have in the I've led smoking campaigns in Southeast London and some other areas, and yes, so we've been using remarketing because we know that the smokers that are left maybe will show some curiosity to one of our adverts, we'll get their attention, but it might take several times for them to see an advert before they actually convert and make a self-referral to a service. We're also using search and looking at the commonly used, the search terms that people search for commonly around stopping smoking and that kind of thing, and trying to intercept there. So yes, we have. Is there anything you wanted to add to that, Matt, with your work around smoking?
User experience, really
Yes.
easy referral form. Don't ask a million and one. You don't need
Yes.
to know what they had for dinner 3 weeks ago. It's just the data that they need to give you to start that referral process. Search works really well. Snapchat lead generation in app is really good for smoking referrals. And one we're going to be testing is YouTube have launched a lead generation function as well. So you can have an advert about the benefits of giving up smoking, and then once someone watches to that skip ad moment that appears in the bottom of the screen, a lead form will appear below there, which is auto-populatable from a mobile device, and then that data can go through to the service as well. So I sort of focus on those sorts of areas, and positive reinforcement messages. So even if someone, again, you would probably need to have your remarketing pixels installed, but after someone has completed a referral, making sure that when they're in their social feeds or on YouTube or on news sites, having an ad like "keep up the good work, good things happen when you quit, just remember why you've done this," that sort of positive reinforcement messages going on there.
Yeah, thank you. This is an interesting one. What are your thoughts on using forums like Reddit to signpost to services and getting involved in discussions around drugs or mental health topics?
We're doing a lot of testing with Reddit of late. You can end up becoming a topic a lot of the time of Reddit when the ads are appearing. I would handpick the campaigns that you're going to appear on Reddit and maybe focus on search to begin with. Get search, because again, I hate the phrase, but that the low-hanging fruit, people that are actively searching, bring those people across and get them the help that they need first, and then start looking at some of the other platforms. Reddit can be problematic. It's quite expensive on a cost per outcome basis compared to search. But I'd test it if you're having to go individually. I'd have a test and see how you get on, because obviously every location, every demographic, every audience is slightly different.
Great, thank you. Again, this is an interesting one. Do you think the private sector would ever consider not bidding on key searches that suggest support is needed? I mean, I think that's not. I think possibly, but I think in a way we as a public health comms profession, we should be trying to take that up with some of the organisations who might lobby for that sort of thing on their behalf, potentially. So whether that might be, I don't know, Royal Society of Public Health or people like that, I don't know. But yeah, I don't know. You've got any thoughts on that, Matt?
It's almost saying, would they stop wanting to make money?
Mm.
I think they're they're a machine, aren't they, nowadays?
I don't think we can speak to their good nature.
I don't think they have a good nature, in all fairness.
No. Okay, and question from Anne-Marie. I may have missed it, but I didn't see women in your target group. Data says they're a target for the gambling firms. Does this reflect that they are looking at other channels for support that don't show up in search?
So with search, it's not gender specific. It's anyone that's searching. Bingo is probably the biggest problem with female online gamblers. So the keywords will be slightly different, but it's all encompassed in the profile that we use. We do target females in all the campaigns that we run, but the main areas of focus were the tradesmen, the shift workers, and men 25 to 55, because they're the biggest target for the gambling firms. So that's why we try and get the creatives in front of them as much as possible. But we do always target female groups, and if any females are searching for gambling help, spending too much on bingo sites, whatever that search might be, we're still targeting them to bring them across to get them the search, the support that they need.
Right. So I think most of the rest of the chat is more comments. So I guess we'll just take one final opportunity for anyone got any final questions. Otherwise, we'll wrap up there. Can't. Oh, sorry. There's just one coming from a couple coming actually now. So what do you think is the most effective format for a stigma reduction ad? So I'll come in first, and Matt, you might want to add to it. I mean, I think looking at the studies and looking at things like what worked with Time to Change campaign, and what has there's some studies that look at gambling in particular. I think it is relatable stories and experiences that people can relate to, and incorporating that into the messaging, not making it to help people understand. Anything you want to add to that, Matt?
I think video content becomes really powerful. Real stories from real people being everywhere, to almost social norm talking about it.
Yeah.
If everyone's hearing about it everywhere, then everyone talks about it, and then that reduces the stigma. So I think getting real stories from real people that have gone through the support services and come out the other side talking about their sort of positive interactions with the service and what it's actually changed in their life, and getting that out on and YouTube these days, you can 3, 4, 5p cost per video view. So running it across YouTube and then use native partners and making sure that everyone kind of sees the video as much as possible.
Yeah, thanks, Matt. I mean, the behavioural scientist in me as well would say that we should actually to understand that fully, we should do a behavioural diagnosis and understand what is causing the feelings and behaviours related to stigma, and what might help nudge people to might increase awareness, I guess, of the real issues. And then last question we'll take from Karen. Can you suggest any resources to get up to speed with understanding all this stuff? It's a completely new area for our authority. Does the hub offer training? So The hub doesn't offer training. We do provide regular webinars on this and related topics. So if you haven't, please sign up to the Public Health Comms Hub, and you'll automatically get invited to any kind of future sessions. I do personally provide in-house bespoke training for communications and public health teams around developing some of this and using some of the insight we've covered today. So reach out to me. I'll be happy to have a chat. Yeah. Just to kind of wrap up and summarize, I think some key takeaways I got from what Matt said, which was really enlightening. I think getting the channels right, making sure we're not sending people to Google and the clutches of the unscrupulous advertisers is really important. That simple choice architecture, simple forms, take them somewhere and don't overwhelm people for each of these areas. Retarget people because they may not have converted straight away, or if you know that they've shown an interest in this topic somewhere else, then retarget them and follow them around the internet like that annoying pair of shoes. Using relatable stories and experiences in the messaging, try and destigmatize where you can, and use an evidence base to do that. And the key one as well is developing your tactics and your messaging around what people are searching for, not what you want or what your aspirations are, but base it around because that, as Matt said at the start, that shows where the unmet need is, because that's what people are looking for. Anything you wanted to add before we close, Matt?
No, I enjoyed it. I could talk about this forever, this stuff. So yeah, if anyone wants to chat, just drop me a message and let me know, and happy to share insight in your local areas too.
That's great. Thank you very much. And thank you everyone for coming. And yeah, do drop either of us a note if you would like to have a chat.